Are you also confused about vitamin D, like many other people are? Your doctor says you don't need it, or just a little bit in the wintertime. Your alternative practitioner may tell you, no, you don't need vitamin D every day. Who is right? As always, there is a link below in the description. You will find a website with more information. There you will find a lot of information about vitamin D. Vitamin D is the so-called sun vitamin. We are talking about vitamin D3. Why is it called sun vitamin? Because it is produced in the skin, when you are in the sun. But of course, only if your skin is exposed to the sun, so it only takes place in the summer. I have also heard from doctors, go outside for 10 minutes, even in the wintertime, with toucan scarf, and this should be enough. It's so important that you educate yourself on how vitamin D gets generated. First, we will need a sun angle of at least 45 degrees. Or in other words, your shadow must not be longer than your body. This is a 45-degree angle. If the angle is deeper, or shadow longer, no vitamin D is produced. For half a year, the amount of sun is already too low. So in winter, you do not produce vitamin D, and in the summer, when it rains, or if you're fully dressed, there's no vitamin D, there is no vitamin D, no production either. You actually have to go outside in the sunshine, in your bathing suit, for your body to produce vitamin D. Vitamin D is produced by UV radiation of the sunlight. Sunburn is caused by UVA radiation. We're talking about UVB, and this UVB effect is blocked when you put on sunscreen. I have nothing against sunscreen, but you need to know that you will then have no vitamin D production in your skin. I always recommend, why don't you go out in the sun for 10 minutes in the spring? Increase this a little until the skin becomes slightly brown. And when it is slightly brown, you can go out in the sun for half an hour. And only then should you apply sunscreen. Then you will have your own production of vitamin D. Another thing, when children or teenagers are out in the sun, in their swimwear, they produce over 10,000 units of their own vitamin D per hour. And in medicine, it is claimed that anything above 800 units is dangerous. It may provoke a vitamin D poisoning and can harm you. But then all our school children would be sick after summer vacations. But this isn't the case. It is important to know that we ourselves produce much more than what medicine or even authorities recommend us with their guidelines. It is also important to note that the vitamin D production decreases in the course of our life. So for me, I produce a quarter of what you produce at the age of maybe 25. The older people get, the more you have to replace vitamin D. In traditional medicine, 800 IU, or international units, per day are recommended. And in my opinion, that is far too little. Most naturopaths or integrated doctors will recommend 4,000 IU. So who is right? We need to look at what happens in the body when we take additional vitamin D. The usual laboratories have given standard values. You can easily measure vitamin D in the blood. In Switzerland, a normal value is between 50 and 150 nmol. And in Germany it is 20 ng or ml. Then it is normal. My experience has simply been that it's too little. My normal value for Switzerland is 75 to 220. And for Germany at least 30 or higher. I feel that this is a relatively good vitamin D supply for normal people who are healthy. But now it depends if you have a disease. An autoimmune disease, for example, such as multiple sclerosis or polyarthritis, or even if you have a tumor, the vitamin D level is incredibly important. We know that vitamin D alone can improve both cancer diseases and severe autoimmune diseases. The values I recommend for healthy humans are 150 to 200 nmol, or 60 to 80 ng or ml. Those are the numbers I try to target. You just prescribe vitamin D, measure the levels after 6 months, and see if it has increased. For serious diseases, autoimmune and cancer, I go even higher, about 200 to 250 or 80 to 100 in Germany. I have made good experience with these values. People are better off and illnesses are milder. Even if you are under immunosuppression, which is often the case with cancer and with autoimmune diseases, the healthy immune system can be strengthened and help improve the course of these sicknesses. When is it essential to take vitamin D? Most importantly, when your immune system is weakened, when you get sick multiple times every winter, with a flu or cold, then you definitely need vitamin D. The immune system needs vitamin D. It also needs omega-3, magnesium and zinc. But vitamin D is the key substance for a healthy immune system. Then there is the disease osteoporosis, very common in women over 50. If you measure bone density, almost all women have osteoporosis. I assume that hundreds of thousands of women are walking around and don't even know that they have osteoporosis, and therefore are not treated. This disease is treated with medication, and I have good experience with vitamin D. At least 4,000 units plus vitamin K2 and magnesium. This is my treatment for osteoporosis. Vitamin D is also important for our brain, both for the normal brain function, but also for mental disorders. Be that depression or dementia, or in children, ADD or ADHD. Vitamin D is a key substance. Of course, here it needs much more. This is not the treatment for these diseases, but you must use vitamin D in these cases. Multiple sclerosis is also a wonderful example. I like to give 10,000 units. It is always difficult because conventional medicine does not understand this and tries to discredit integrative medicine by saying that it can be dangerous for patients. I have already had patients where the vitamin D level in the blood was over 400, and nothing happens. Nothing happens. I've never seen a serious side effect from using higher doses. I don't recommend to go that high. But with 8,000 to 10,000 units, I have never had a problem. I want to take away people's fear of vitamin D. A further question. Do you always have to add vitamin K? This is constantly asked today and described in many articles. My answer is a small dose, 2,000 or less. There is no need for a vitamin K2. At 4,000 or higher, recommend adding vitamin K2, simply because the metabolism of vitamin D happens faster and better. It is more effective if you take K2 together with vitamin D. However, K2 is constant. You need 200 micrograms per day, and that is why I do not recommend these mixed products. There are many mixed products where both are in it. Of course, this is very convenient. But if I now take mixed products and someone takes 2,000 units, then he has too little K2. If I have to go to 10,000 units, you may have too much K2. So I prefer to separate these two things. Vitamin D I can vary from 2,000 to 10,000 units. And K2 is always constant at 200 micrograms.